The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, here with another edition of Inside JACC, and here to discuss with me the important question about how much clopidogrel should be used as a maintenance dose in patients after PCI is Dr. Giuseppe Patti. And Dr. Patti is Assistant Professor of Medicine at the Biomedical University in Rome and one of the important members of the ARMYDA study group. So Giuseppe, tell us a little bit about your study.
Previous studies demonstrated that a high clopidogrel maintenance dose of 150 mg per day is associated with a stronger platelet inhibition. But in our ARMYDA-150 study, we explored the issue of whether the high clopidogrel maintenance dose, in addition to stronger antiplatelet effect and a reduction of low responder patients, may exert anti-inflammatory effects or may also improve endothelial function in patients undergoing PCI.
So as I recall your protocol, what you did was wait a month and then give double the dose with a 30-day crossover. Yeah. Tell us what you found.
We found that, as expected, patients receiving the high clopidogrel maintenance dose showed increase in platelet inhibition, and patients with low response to the drug were reduced. But with regard to possible anti-inflammatory effect and pro-endothelial effect of the high clopidogrel maintenance dose, we found that use of the high clopidogrel maintenance dose was associated with a significant twofold increase in flow-mediated dilation, and was also associated with a significant 42% absolute reduction of patients with impairment of flow-mediated dilation, as indicated by FMD flow-mediated dilation below the cutoff of 7%. And finally, we found that a high clopidogrel maintenance dose was associated with significant anti-inflammatory effect, with a significant twofold reduction of C-reactin protein levels and significant 18 absolute reduction of patients with persistently high levels of C-reactin protein above the cutoff of 3 mg per liter.
Well, these are very impressive findings to reduce inflammation, to enhance endothelial function. So there's a suggestion of a pleiotropic effect of clopidogrel, perhaps even unrelated to its antiplatelet effect. Seeing this, do you feel that patients now all should receive 150 milligram clopidogrel maintenance?
I believe that our data should be considered in light of recent investigation demonstrated that patients with endothelial dysfunction after PCI may have a significantly higher risk of in-stent stenosis after bare metal stent implantation, or endothelial dysfunction may predispose to stent thrombosis after drug-eluting stent implantation. Moreover, it is now well known that a high inflammatory status may be correlated with an adverse outcome during follow-up after PCI, and lowering of this inflammatory status may favorably impact the prognosis. Thus, I believe that patients with persistently high platelet reactivity after standard clopidogrel doses, but patients with, in addition, have endothelial dysfunction or high inflammatory status might derive a significant clinical benefit from administration of 150 milligram per day clopidogrel doses.
Well, that's really fascinating, using endothelial dysfunction and elevation of CRP as perhaps an indication for an alternate dose. I guess one of the limitations of your study is that it was all surrogate endpoints. You don't have data on hard outcomes like infarction.
Yeah, but in fact, this is right. In fact, our study was not a study powered to identify a clinical benefit in terms of reduction of ischemic events or in terms of possible evaluation of an increased risk with the high clopidogrel maintenance dose. But I believe that our study may be an hypothesis-generating study which should be confirmed in the ad hoc larger clinical prospective studies.
Absolutely. We were fascinated. It's really an excellent hypothesis to assess endothelial function, to assess inflammation, and then to gauge your clopidogrel and or other antiplatelet therapy. Very interesting, and I'm going to bet that the all-Italian ARMYDA group will be one of the study groups that gives us that answer. For Inside JACC, I'm Tony DeMaria.